Hello everyone, my name is Jaskiran Kaur. I'm a student at Indiana State University in my nursing 444. This is my community health project related to alcohol and drug use and abuse. First of all, let's pause here and then do the pretest. Objectives. My objectives for these presentations are identify the addiction process for alcohol, prescription medication, and illegal drugs, identify commonly abused prescription and illegal drugs, use resources to support patients or other people who are interested in cessation, recognize various oral conditions that may be present with chronic nicotine, alcohol, prescription medication, and or illegal drug use. Differentiate between a social user, substance users, and addict. What is alcohol addiction? Alcohol addiction, also known as alcoholism, is a disease that affects people of all walks of life. It is important to note that alcoholism is a real disease. It can cause changes to the brain and neurochemistry, so a person with an alcohol addiction may not be able to control their actions. Alcohol addiction can show itself in a variety of ways. The severity of the disease, how often someone drinks, and the alcohol they consume varies from person to person. Some people drink heavily all day, while others binge drink and then stay sober for a while. What health complications are associated with alcoholism? Ulcers, diabetes complications, sexual problems, birth defects, bone loss, visual problems, increased risk of cancer, suppressed immune function. Um, Prescription drug abuse. Some people abuse prescription drugs before they think they will help them have more fun, lose weight, fit in, and even study more effectively. The most commonly used prescription drugs fall into three classes. First, opioids, that includes oxycodone, hydrocodone, and meperidine, Demerol. And then second are central nervous system depressant that includes phenobarbital, diazepam, Xanax. And number three is stimulants like methylphenidate and amphetamine, dextroamphetamines. Never use someone else's prescription and don't allow anyone to use yours. Not only are you putting others at risk, but you could suffer too. Pharmacists may be stopped from refilling a prescription if a medicine has been used up before it should be. And if you're found giving medicine to someone else, it is considered a crime and you could find yourself in court. And in this picture, it says painkillers are easy to get into, hard to escape. Oral conditions with alcohol and drug abuse. Patients with substance abuse disorders experience more severe caries and periodontal disease than the general population and are less likely to receive dental care. Xerostomia is often a side effect of using opioids, amphetamines, barbiturates, hallucinogens, marijuana, or alcohol, as it is shown in the following picture. The right one shows that a xerostomia. Addiction statistics. 20 million Americans, over 20 million Americans over the age of 12 have an addiction, that excluding tobacco. 100 people per day die from overdose. This rate is tripled in the past 20 years. 5 million visits. There are 5 million of emergency room visits in 2011 were related to drugs or alcohol. What do you need to know? Alcohol is a depressant. Alcohol depresses the central nervous system, beginning with the first drink. Alcohol has no nutritional values and lots of calories. In low doses, alcohol creates a feeling of warmth and lowered inhibitions. In higher doses, alcohol can have serious consequences. This slide mentions how long does alcohol stay in your system. So alcohol detection times are in breath up to 24 hours, urine 10 to 12 hours, blood up to 12 hours, saliva 1 to 5 days, and hair up to 90 days. Effects of alcohol on the brain. There's a slurred speech, numbed senses, confusion, blackouts with partial or complete memory loss, Wernicke-Korsakoff syndrome from alcohol abuse, withdrawal symptoms. This picture mentions how to cut back on drinking. It's a count your drinks, learn to refuse, and drink spacers, pace yourself, and remember to eat. There is a difference between substance abuse and addiction. And this picture shows substance abuse can appear casual while addiction usually exhibits more serious symptoms. Addiction is nearly always associated with withdrawal symptoms. Addiction is considered a mental disorder, while substance abuse is not necessarily a diagnosis. Substance abuse alters the brain briefly, while addiction alters the brain permanently. So there in this picture it says substance abuse versus addiction. Abuse is not necessarily associated with withdrawal symptoms. People can abuse substance intermittently without developing physical dependence on them. A major sign of addiction is when someone starts experiencing withdrawal symptoms. As such, addiction is the final step in the progression from substance abuse to dependence. Blackouts are not normal. Alcohol affects the way your brain processes information, including the way it memorizes and stores information. Alcohol can cause gaps in memory the next day. You are put at risk, serious risk of injury, unsafe sex, acquaintance, rape, violence, legal problems, and death if you're drinking to the point of blackout. Don't drink if you don't want to. You are under 21. You are upset, anxious, or angry. You are driving or operating machinery. You are taking any kind of medications. Most importantly, you are responsible for your decision to drink or use drugs, and only you will suffer the consequences that may result from making poor decisions. So it's always person's decision if they want to drink or not, and if they want to choose this way or that way. And the picture below shows says it says you and only you are responsible for your life choices and decisions. So think before you drink. This slide has a references you can go to for more information about this alcohol and drug abuse and use. Um, that's all. And then now you can do the post test. Thank you.